In this video, I'm going to show you how to screen for raised blood pressure and hypertension. But first, I'm going to show you how to prepare the patient and the instruments. Second, I'm going to show you how to determine the correct cuff size. Third, how to measure blood pressure using a digital device. And fourth, how to measure blood pressure using a manual device. Finally, I'm going to show you how to interpret the results of the measurement. Correct positioning of the patient is essential for accurate measurement of the blood pressure. The patient's back should be supported with the back resting on the back of a chair, the legs uncrossed and the feet resting on the floor. The patient's arm should be bare to the shoulder and the arm should be supported at heart level. These are the instruments used for measuring blood pressure with a manual device and these for measuring blood pressure with a digital device. For manual measurement of blood pressure, the auscultatory method, you will need a stethoscope and a sphygmomanometer. The sphygmomanometer has a blood pressure cuff, a rubber bulb for inflation, an adjustable valve for controlling air release, flexible tubing, and a manometer. The needle of the manometer should be placed at the zero before and after measurement. For digital measurement of blood pressure, you will be using an instrument like this one that also has blood pressure cuff, flexible tubing, and a digital monitor. To choose an appropriate cuff, you need to assess the arm circumference, which needs to be measured at the midpoint position of the upper arm, which is determined by assessing the distance between the olecranon and acromion. Cuffs are usually marked with acceptable sizing indicators to facilitate proper fitting. The index line should fall within the range line when the cuff is secured to the upper arm. The cuff should be placed about 2 centimeters above the crease of the elbow. It should be tight but still. Allow 2 fingers width under the cuff. Then look for the brachial artery and place the stethoscope on the skin lightly against the brachial artery, but with appropriate pressure to ensure good transmission of the sound. Also ensure that the stethoscope is not in contact with clothing or with the cuff. Now with the rubber bulb, you can inflate the cuff as you listen to the pulse sounds. When the cuff has inflated enough to stop blood flow, you should hear no sounds through the stethoscope. Begin deflation, releasing the air of the cuff at a moderate rate such as 2 to 3 millimeters mercury per second, as anything faster may likely result in an inaccurate measurement. Listen with a stethoscope and simultaneously observe the sphygmomanometer. The first knocking or rhythmic sound heard as blood begins to flow, that is the subject's systolic pressure, the value at which the needle is pointing when the first sound is heard, and is known as Korotkov sound. Then continue listening as the cuff pressure drops and the sounds fade. When the knocking or rhythmic sound disappears, that is the diastolic pressure and is the value at which the needle of the sphygmomanometer is pointing when the sound disappears. Measure the blood pressure 2 or 3 times at least 2 minutes apart and take the average of these readings to increase accuracy. Typically, blood pressure is higher in the mornings and lower in the evenings. Inflate the cuff with a bulb or press the start button if you have a monitor with automatic cuff inflation. Watch the monitor and wait until the results are displayed on the screen. A long beep will indicate that the measurement is complete and the cuff will fully continue deflating. Systolic blood pressure appears on top of the monitor and the diastolic blood pressure appears directly beneath it. Once you have the results, you can interpret them like this. Patients have a normal blood pressure if their systolic blood is below 120 millimeters mercury and their diastolic blood pressure is below 80 millimeters mercury. Patients are classified as to have pre-hypertension if their systolic blood pressure is between 120 and 139 millimeters mercury, or their diastolic blood pressure is between 80 and 89 millimeters mercury. Finally, patients have hypertension if their systolic blood pressure is above 140 millimeters mercury or their diastolic blood pressure is above 90 millimeters mercury.